Okay, in this section of Chapter 31, we're going to be talking the part that all the students just really seem to love, the sexually transmitted infections. Okay, you may hear me say STDs. STDs is not so in vogue right now because by saying something to disease, disease, chronic, can't be treated, stigma. So by calling it a sexually transmitted infection, well, infections come and go. Infections can be treated. Infections will then go away. So that's why you'll see STIs versus STDs nowadays in textbooks and the primary literature. Now, when it comes down to the STIs, STDs, tomato, whichever, there are numerous bacteria, viruses, protists, even fungi that can cause these diseases. Remember, these are going to be human to human. Okay, passed in direct contact as well as exchange of body fluids from the genitals. Okay, and no, does not matter. You're talking penis and vagina, vaginal sex, penis and anus, anal sex, doesn't matter if it's man and woman, man and man, or woman to woman. Many of these all can be passed person to person. So whatever variations you're doing there, okay, there's not, oh, it only does this one and this one only. When you go through and you look, the top, what is it? 1, 2, 3, 4, 5, 6, 7, 8, 9 that we're going to talk about. These are, and the next one, 10, 11, 12. Top 12 that you'll see here in the States. Go elsewhere, you might find other ones. Gonorrhea, syphilis, chlamydia. Lymphatic, Trachomatis, Chlamydia Trachomatis, causing venereal disease, cancroids, herpes. I'm sorry, I don't know why I keep always saying herpes like that. Herpes! I don't know. Genital warts, trichomoniasis, AIDS. Turns out PID, pelvic inflammatory disease, for many women, it's going to be caused by one of our STI organisms. And then candidiasis, Candida albicans, basically yeast infection. So, section 13, going to talk bacterial. Now, these aren't the only bacterial STIs, but they're the first three, the top three that we're going to talk about that you're going to see here in the States more often than not. Gonorrhea, syphilis, and chlamydia. Turns out gonorrhea, syphilis are easily preventable, easily treatable. Okay? Gonorrhea, we'll talk a little bit, may not be so much in the past few years. There's been a few red flags thrown, but we'll talk about it in a minute. Overall pattern disease. Gonorrhea, highly prevalent, often asymptomatic. Yes, there is a chance that one of you young ladies listening to this may have it. But because you're not showing any symptoms, no inflammation, no discharge, and yeah, discharge is a different kind of discharges, are diagnostic criteria for the different infections. Well, because you're not showing any symptoms, you don't know you have it. You are a carrier. You are spreading it to either other women, to other men, to men. Syphilis has a few obvious symptoms. Okay, you're going to get rashes depending upon which stage. Turns out syphilis has multiple stages. Some sort of a canker at the site of the infection. That clears up, goes away, comes back. You have a rash, head to toe rash, but more importantly, you get the rash on the palms of your hands. Clinical diagnostic tool. And then finally, the tertiary syphilis, This is the one that's in your brain, but you also get these things called gummas. These are going to be growths where the syphilis is coming out on the skin in certain areas, and it's remodeling. It takes on this really gummy appearance. The tissue, the skin tissues, the underlying tissues just look gummy. I mean, and they get this ulceration, but the problem is they're also showing signs of like dementia, and their brain chemistry is going off because they now also have neurosyphilis at the same time. Gonorrhea and syphilis. Well, you look at what's going on. World War II. Syphilis numbers skyrocketed. Yeah. Turns out the Army, Marines, Navy lost more people that became non-combat ineffective. They lost more people to venereal diseases than they did to enemy fire. I don't mean losses and they died. I mean they just couldn't put them out there to fight because they were going and they were seeing prostitutes. Yeah, no joke for that. But anyways, they were getting it. They were picking stuff up. And notice, penicillin is not coming along until near late of World War II. So once penicillin came out, yeah, syphilis numbers, boom. Syphilis is still one of the few infections out there that penicillin works great at. Gonorrhea, well, it came, when the syphilis numbers dropped, gonorrhea numbers went up. Then they went back down. You look at the 50s, 60s years, the whole Ozzie and Harriet years, not a lot going on. Then you hit the late 60s and gonorrhea starts going up. What also came out in the late 60s? Birth control pills. Why did you see the drop in numbers and then all of a sudden see them go back up? Because they stopped doing the rhythm method, which means you can only have sex a few times, a few days of the month to not get pregnant, or you had to use prophylactics, condoms, rubbers, whatever you want to call them. The pill came out. Hey, guess what? We don't have to use condoms anymore. Well, you start sharing. Free love. 69, 68, 69, 70, 71. Free love era. Hey, look what's shooting up. As the pill becomes more used, people are becoming more experimental. We'll leave it at that. Gonorrhea numbers skyrocket. Into the late 70s, 80s, all those flower children kind of grew up, got jobs, life changes. And you really see it bottoming out 85 into the 90s. Why? AIDS. People got scared again. People, yes, AIDS was still this gay disease in the late 80s. Or at least that's, what people thought. But we were scared enough that, hey, no glove, no love. Started using condoms again. Increased use of condoms, gonorrhea numbers went down. Now, at the beginning when I started, last slide, when I said, hey, gonorrhea, easy to treat, numbers going down. Yeah, until you look at the far right of this graph. Notice there's this uptick. Yeah, there's been this uptick in numbers. From about here over, post-Clinton years. Clinton told us that it's not sex, you're allowed to do it, so we started getting gonorrhea infections again, but not genital gonorrhea, oral gonorrhea. Numbers started to go down again, and then this uptick as we're starting to see, hey, all those people that were afraid of AIDS right here, not so afraid of it because for some reason people seem to think that we've cured AIDS, so they don't need to be as careful. We've got the pill, AIDS is cured, it's not. So we can start doing what we want again. Problem also is gonorrhea numbers. We see more asymptomatic people, and they're spreading it. But what they're spreading is also a more and more drug-resistant strain of gonorrhea. Yeah, gonorrhea. Why syphilis still can be treated with penicillin? Gonorrhea? Yeah, we're running out of antibiotics. That's what's scaring a lot of people. Now, if a woman, female, does get infected with gonorrhea and they are going to show symptoms, mild vaginitis, some swelling, maybe some itching, maybe not much. Thing is, gonorrhea has been shown to ascend to the vagina, ascend to the spread up to the cervix, cervix to the crap, can't think of my female plumbing. Well, you know what I'm talking about. Cervix up, fallopian tubes, inflammation. Because this is a slow process as it's going up, crossing the cervix, and it's moving up to the fallopian tubes. And yeah, I still can't remember what that part is. So yeah, you can look it up. You can email it to me later and tell me, hey, Dr. Welsh, learn your body parts. Anyways, because it's a slow, methodic spread up, also gives the immune system, the inflammatory response time to kick in. Things start to swell, given enough time because it's not getting cleared out. You know, you get this inflammatory response chronically. Well, chronic inflammatory response leads to tissue architecture restructuring. And that's exactly as dry as it sounds. Basically, the tissues start to scar. Tissues start to change shape. Tissues lose function. So pelvic inflammatory disease due to untreated gonorrhea will render females infertile. It's different for the guys. We're going to know it. First, as gonorrhea moves up the urethra, it's going to cause the inflammation, which means definitely a tube that should be this broad, because of the inflammation, swells, diameter shrinks. We're still trying to push the same amount of liquid through now a smaller straw. You're going to feel it. As that smaller straw gets stretched because of the volume of water going through, our brains are going to read that as pain. Oh my God, it burns when I pee. There you go. That's why it burns when you pee. If, for whatever reason, the guy just is stupid enough not to go get looked at, and it still goes up, still ascends, hits the prostate and stuff like that, well, we get our own version of PID. We start to get scarring and prostatitis and all this stuff like that. And we too can become fertile. It just means that, you know, our little guys can't complete the swim. Pictures of gonorrhea, but they're not too fun to look at. Syphilis. Syphilis scares me. We tied syphilis and gonorrhea together because people who get gonorrhea, pretty good chance they're getting syphilis at the same time, and vice versa. Something about lifestyles and stuff like that, I will let you fill in there. Means if someone's going to expose themselves and get gonorrhea, there's a good chance they expose themselves at the same time and got syphilis, and then they're sharing. Treponeta Pallidum, causative agent of syphilis. Scary, scary thing. Gonorrhea and syphilis can be spread to newborns during birth through the birth canal as they are passing through the cervix, through the vagina. If mom-to-be has syphilis, has gonorrhea, the baby is going to have it smeared. They're going to get it all over them. They are going to become colonized with. Thing is, though, syphilis, unlike gonorrhea, syphilis is not going to stay on the surface. Syphilis will be able to penetrate. They're going to get what's referred to as congenital. Or, I'm sorry, they're going to get it's going to cause them the normal primary, secondary, tertiary syphilis, while they're being born. The scary part is if mom has it while she's gestating, it can cross through the mucus plug. Remember, when women get pregnant, their cervix will get closed up with a mucus plug, so nothing can get up to the fetus, except syphilis can. Syphilis can either penetrate through or syphilis spread through the blood, crosses the placenta, boom. You get the congenital syphilis. Sorry, that's not, I was about to say earlier, congenital syphilis during birth. No, that's normal syphilis in a neonate. They'll never even see it because they won't notice the canker. But congenital syphilis, that means that Treponeta Pallidum is in the developing fetal tissues. It will screw up fetal development. Congenital syphilis, these babies have an altered development. You'll see that with the teeth. When they get it, the teeth, instead of being nice and flat, will have this cupped, serrated look to them. Face flat, maybe even have some form of the primary or secondary characteristics of syphilis when they're born, depending upon when they were exposed fetally. Congenital syphilis, after the baby's born, yeah, they'll give them high-dose penicillin, make sure that all the vegetative cells are out of their body. But any alteration, any damage to the developing fetal tissues, that's set. There's no fixing that. Primary, secondary, tertiary syphilis in newborns through adults, everybody else. Penicillin, yeah, takes care of it. If it's primary or secondary, once the time they hit tertiary syphilis where they have the gammas and then they also have the altered states because it's now neural syphilis, yeah, nothing can be done there. Yeah, the penicillin will get rid of any vegetative cells that might be there, but damage is done. There's no fixing. You look at Treponeta Pallidum. Remember, this is one long cell that has this corkscrew, this spirochete appearance. The way it moves, instead of having a flagella that's outside the cell extended way out, the flagella runs along the cell, so it does this kind of motion through you, through your tissues, through you as it swims through you. Primary, here's the cankers you will find. Doesn't matter if it's oral. Yes, how do you get oral syphilis here? Oral sex, basically. Or you're kissing somebody who's got an open wound. Here he shows it on a penis. These are sites of, where the Treponeta Pallidum is able to penetrate the skin, you'll get an inflammatory response at that place. Boom. So this ulceration here is because Treponeta Pallidum entered into the tissues, underlying tissues here, and then you get this overall immune response as the Treponeta Pallidum is living, spreading here, as it's diffusing through the tissues, swimming through the tissues, and then inflammation, macrophages, neutrophils, and all of that come in here and start basically killing everything. Doesn't work at killing treponema. They just go into hiding. So what's much larger here, all these little spots you see here are the same thing. Then it goes away. It hides in the body. Months, years later, patient will come to the doctor saying, oh, look, I've got this weird rash, these splotches, this splotchy rash, head to toe, palm of my hands. I know some of you are thinking, how's this different than scarlet fever, chicken pox, and all those other rashes we've talked about? Starts at the face, moves to the trunk, all that shit. None of them had rash on the palm of the hands, soles of the feet. This one does. You see a patient that has this, has it on the palm of their hands, ding, 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 ding. I'll bet you $1,000 it's secondary syphilis. If I'm wrong, you track me down. I will pay out. Now, Chlamydia Trachomatis. This is one of our sexually transmitted diseases. Causes two diseases we refer to as non-gonococcal urethritis. Basically, chlamydia has ascended up the urethra, causing inflammation, hurts, burns when I pee, stuff like that. Some discharge, which is basically an overgrowth of, pus. If it was gonorrhea and you had a discharge, it come out of the penis looking like a big snot ball. That's an overgrowth of the gonorrhea, and you're just expelling it out. With chlamydia, not a snot ball, more of a pussy discharge out of the end of the penis. You're not going to see much of a discharge, gonorrhea or chlamydia, in women because both of these are going to be ascending up to the top of the vagina at the cervix. So that's where you're going to see any type of a discharge way up there. So you'll have to have the speculum, and that's the way you're going to have to look to see that. Have to remember, Chlamydia trachomatis is an obligate intracellular parasite outside of our cells. It is a reticulate body. Inside is when it changes to become an elementary body and is able to go through and now be vegetative, go through and binary fission and all that type of stuff.